Hello again, and welcome to Chapter 2, where we will be looking at evidence-supported implementation strategies and how to identify and adapt these to address barriers to implementation of evidence-informed interventions. After listening carefully to this chapter, you will be able to describe different evidence-supported implementation strategies used to address barriers in effective implementation of evidence-informed interventions. Define the concepts of adaptation and fidelity of evidence-informed interventions, and describe approaches and frameworks for adapting evidence-informed interventions. Evidence-informed interventions are what we are trying to implement to achieve improved health outcomes. Implementation strategies are how we seek to implement these interventions and improve normal practice in clinical or community settings. This distinction between what and how is useful in distinguishing between implementation strategies and evidence-informed interventions. Implementation strategies are the methods or techniques used by a program or clinical team to support the adoption, integration, spread, and sustainability of an evidence-informed intervention in practice. Implementation strategies can target determinants at any level of the social ecological model, be that at an individual, community, organizational, or system level. Implementation strategies can be a single strategy, for example, training, or a bundle of strategies addressing multiple implementation barriers, for example training, behavioral change communication, and supportive supervision, combined to facilitate an evidence-informed intervention. The socio-ecological model, SEM, serves as a valuable framework for uncovering the multitude of contextual factors that shape implementation. Originating from the insights of a psychologist half a century ago, SEM has since been commonly used in the realm of health promotion. At its core, SEM delves into the intricate interplay between individual, organizational, community, and societal factors. It shows how individuals, including patients and members of communities, are not only influenced by their immediate social circles, such as family, peers, and partners, but also by the broader contexts within which they exist. This includes communities and organizations like churches, schools, and workplaces, all of which are subject to the constraints of social and cultural norms. This model underscores the impact of broader societal, political, and physical environments on individual behaviors, experiences, and decision-making processes. While the socio-ecological model, SEM, does not delve into specific determinants, it serves as a valuable tool for assessing the barriers and facilitators present at each level of the socio-ecological spectrum. For instance, when seeking to implement a specific evidence-based intervention, one might examine how factors such as organizational leadership, community dynamics, and policy frameworks could impact the implementation process. Furthermore, the SEM can be effectively complemented by other frameworks designed to describe contextual factors, such as the Consolidated Framework for Implementation Research, CFIR, Context and Implementation of Complex Interventions, CICI, and Promoting Action on Research Implementation in Health Services, PARIS. By integrating SEM with these frameworks, researchers and practitioners gain a more comprehensive understanding of the multifaceted influences shaping implementation efforts. After pinpointing these contextual factors at different levels, the next step involves choosing appropriate strategies to tackle the barriers and facilitators to implementation effectively. This process typically begins by mapping the identified determinants to specific implementation strategies. For instance, certain strategies may be tailored to address particular barriers, while others may focus on bolstering or leveraging enabling factors. These enabling factors could include elements like a cohesive team structure, robust data infrastructure, or influential leadership within the organization. By aligning strategies with the identified determinants, organizations can optimize their approach to implementation and maximize the likelihood of success. The Expert Recommendations for Implementing Change, ERIC, project published a comprehensive compilation of implementation strategy terms and definitions by gathering inputs from stakeholders across implementation science and clinical practice. ERIC comprises over 70 different types of implementation strategies, mapped to 9 conceptual areas. This compilation stands as a foundational resource for organizations seeking to address specific determinants in their implementation efforts. When utilizing ERIC to select strategies, the process typically begins with identifying the conceptual area that aligns with the identified barriers and facilitators, relevant to the evidence-based intervention under consideration. For instance, in the context of implementing routine vaccination programs aimed at preventing infectious diseases among children in low- and middle-income countries, teams may identify several conceptual areas for targeted strategy selection. These could include stakeholder engagement and relationship building, and may involve initiatives such as establishing connections with local opinion leaders, like village chiefs, school teachers, or religious figures. Training and education could also be included, with efforts to equip stakeholders with the necessary knowledge and skills to support the implementation process. Additionally, infrastructural development may emerge as another crucial conceptual area. This could encompass initiatives like implementing a new medical record system, designed to identify and follow up on children who have missed vaccinations. In some cases, organizations may find it necessary to develop entirely new strategies, tailored to their specific context. However, it's essential that such formulation is guided by theory and evidence. This ensures that the proposed strategies effectively address the identified determinants and articulate how their implementation will lead to the desired outcomes. After selecting the implementation strategy, the next critical step involves delving into the specifics by naming, specifying, and planning the strategy. This approach is grounded in the rationale that the implementation team must have a clear understanding of the tasks at hand, including who will be involved and how often these activities will occur. Furthermore, the team will clarify the intended outcomes the implementation strategy hopes to achieve. These outcomes could range from getting healthcare providers to use a specific evidence-based intervention more often, or making the intervention more accepted by the people it's meant to help. Additionally, the team will explain why they chose this strategy, making sure everyone on the team understands its purpose and objectives. For instance, let's consider a way to make telemedicine work better in healthcare. One approach, called audit and feedback, involves giving providers regular reports on how well they're using telemedicine compared to others. Clinic managers share data on telemedicine usage, who it's used for, and when. This helps providers see what works and encourages them to use telemedicine more effectively. It also helps identify early adopters who can spread telemedicine practices to other clinics. In addition, it helps us see if telemedicine is reaching everyone fairly, so we can make adjustments to ensure equity in healthcare access. Evidence-based interventions do not adhere to a one-size-fits-all approach. In the following section, we delve into the nuances of different types of adaptations and highlight the importance of tailoring evidence-informed interventions to better suit the target population or local conditions. Adaptation involves purposefully modifying an evidence-informed intervention to enhance its alignment with the specific context in which it is being implemented. Traditionally, evidence-informed interventions are developed within controlled settings such as clinical trials, which often involve a relatively homogeneous population. However, real-world conditions and broader health systems present a diverse array of contextual factors that necessitate intentional adjustments to the intervention. These adaptations can be categorized into two main types: planned adaptations, which are made before introducing a new intervention, and responsive adaptations, which are made in response to emerging contextual issues during implementation. Before delving deeper into the topic of adaptation, it's essential to grasp some key concepts related to this process. Let's touch on these briefly. Treatment modification encompasses any changes made to interventions, whether proactively or reactively, to address unanticipated challenges that arise during implementation. For example, adding other antigens to a vaccine to address other kinds of diseases that may be relevant in a given context, other than the disease for which the vaccine was originally developed. Treatment adaptation involves purposeful alterations to the design or delivery of an intervention to improve its fit or effectiveness in a given context, while preserving its core functions. For example, this might include repackaging a vaccine for ease of administration in areas that may lack infrastructure to maintain the potency in its original package format. Treatment fidelity refers to the degree to which the delivery of an evidence-informed intervention aligns with its original protocol or intended design. Striking a balance between fidelity and adaptation is crucial for ensuring the effectiveness of interventions. These concepts highlight the delicate interplay between fidelity and adaptation, emphasizing the need to tailor interventions to specific contexts while maintaining their essential components. In a thorough examination of adaptation frameworks and models for public health evidence-informed interventions, Escoffery et al. Conducted a systematic review encompassing 13 frameworks. From this review, they derived 11 steps for program adaptation. These are: assess the community, understand the evidence-informed intervention, select the evidence-informed intervention, consult with experts, consult with stakeholders, and decide on needed adaptations. Adapt the original evidence-informed intervention. Train staff. Test the adapted materials. Implement the adapted evidence-informed intervention. And finally, evaluate. Certain adaptation frameworks highlight the importance of choosing an evidence-based intervention that aligns with the characteristics of the target population and setting. This process underscores the necessity for close collaboration with stakeholders and a thorough understanding of the potential evidence-informed interventions, their evidence base, and their relevance to the population and setting. Stakeholders involved in this process may include those who will deliver the evidence-informed intervention, its beneficiaries, administrators, and leaders. In assessing the suitability of the evidence-informed interventions, a structured data collection process is essential. Establishing academic partnerships can be a valuable approach to engaging individuals who can aid in this assessment and offer recommendations for adaptation based on research and evaluation findings. Adapting evidence-informed interventions in new contexts may prove more efficient than developing entirely new interventions for each unique setting. Two primary considerations for this adaptation process include addressing barriers that could hinder progress toward the evidence-informed intervention's goals in the new context, and incorporating an equity lens to cater to the specific needs of vulnerable populations, communities, and settings. These considerations can be systematically navigated through the application of adaptation frameworks. This section delves into various frameworks or approaches, such as iterative decision-making for evaluation of adaptations, IDEA, Model for Adaptation Design and Impact, MADI, and Framework for Reporting Adaptations and Modifications, FRAME. These frameworks offer systematic methodologies for guiding the adaptation process, ensuring thorough consideration and evaluation of adaptations made to evidence-informed interventions. Let's take a moment to look at each of these in a little more detail. IDEA, the iterative decision-making framework, serves as a structured approach to aid decision-making regarding the necessity of adaptation and how to evaluate the adaptation's objectives. This framework operates on the premise that stakeholders have already identified an evidence-based intervention and are now deliberating whether and how to adapt it to enhance its effectiveness in a particular setting. The IDEA process entails several key steps. The first of these being determining whether an adaptation to the evidence-informed intervention is required based on initial data, theory, or stakeholders' input. Secondly, evaluating whether fidelity to the original intervention is maintained, with its core functions preserved, or compromised, necessitating adaptation or elimination of core functions. Then, conducting thorough data collection, especially in cases where fidelity and consistent adaptations are proposed, to inform decisions regarding alternative adaptations or strategies. And finally, determining the achievement of success in implementing the evidence-informed interventions based on predefined criteria established at the outset of the process. If key stakeholders are excluded during the evidence-informed intervention selection and adaptation process, the intervention can face several risks to its success. Proactive collaboration and integration of inputs from stakeholders at different levels is essential for successful adaptation. Stakeholder engagement stands as a core component of implementation research. It is also important to evaluate, during the stakeholder engagement phase, whether the core components of the evidence-informed intervention will need to be preserved, or whether a new intervention needs to be developed to address the health problem in that specific context. The Model for Adaptation Design and Impact, MADI, sheds light on the complex interrelationships between adaptations and their intended and unintended outcomes throughout the adaptation process. It underscores how a single adaptation can have a ripple effect, influencing multiple outcomes in both expected and unexpected ways. MADI specifically identifies the characteristics of adaptations, their intended and unintended impacts, and the potential mediators and moderators that influence the adaptation's effects on outcomes. By examining these factors, MADI offers insights into how adaptations can shape the overall impact of interventions, providing valuable guidance for adaptation effort. FRAME, the Framework for Reporting Adaptations and Modifications, is a comprehensive evaluation framework designed to facilitate the systematic cataloging of the adaptation process. It comprises 8 key aspects, aimed at describing the nature and types of adaptations made to evidence-based interventions. Let's look at those 8 aspects. 1. When in the implementation process is the adaptation made? 2. What is the extent to which adaptation is planned? Is it proactive or unplanned and reactive? 3. Which stakeholders were involved in the decision to adapt, and how to adapt, the evidence-informed intervention? 4. What component was modified? 5. What is the level of delivery at which modifications were made, for example at the individual, organizational, or community level? 6. What is the type or nature of content-level material? 7. Were adaptations' fidelity consistent? Were core components of the evidence-informed intervention preserved or eliminated? 8. What was the reason for adaptation? What is the goal of the modification, and what were the relevant contextual factors that informed the decision? ADAPT is a new consensus-informed guidance aimed at facilitating the adaptation of interventions to achieve a good fit between the intervention and its contextual surroundings. Developed through meticulous systematic review methods, qualitative interviews, extensive consultations, and formal consensus methods, ADAPT offers a comprehensive step-by-step guide for planning the adaptation of an evidence-based intervention. ADAPT is a new consensus-informed guidance aimed at facilitating the adaptation of interventions to achieve a good fit between the intervention and its contextual surroundings. Developed through meticulous systematic review methods, qualitative interviews, extensive consultations, and formal consensus methods, ADAPT offers a comprehensive step-by-step guide for planning the adaptation of an evidence-based intervention. Let's summarize what we have learnt in this chapter. Evidence-informed interventions are the what you are wanting to implement, and implementation strategies are the how of implementation. Implementation strategies target determinants at any level, individual, community, organizational and system level, and can be single or multiple strategies. Adaptation is the intentional modification, either planned or responsive, of an evidence-informed intervention to achieve a better fit between the intervention and context. Adaptation needs to be balanced with fidelity and not compromise core elements. There are different frameworks for guiding adaptation of an evidence-informed intervention, each useful for different aspects of IR, and all involve working with stakeholders. The IDEA framework is helpful for guiding decisions on whether to adapt an evidence-informed intervention or develop a new intervention to address a health problem in a given context. If one chooses to adapt an evidence-informed intervention, the MADI framework is helpful for anticipating both the expected and unexpected outcomes that may result from the adaptation process. The ADAPT framework is helpful for actually planning the adaptation process. FRAME is helpful for describing and reporting the adaptation process, which may facilitate a more rigorous and robust evaluation of the adaptation process. That is it for this chapter, but before you go, take a moment to consolidate what you have learnt by putting it into practice. Download this chapter's supporting resource material, and complete the activity there. Once you have completed the activity, please join us for Chapter 3, where we will learn more about the core elements of evidence-informed interventions.